Hi, I'm Tessa Gordon, and I'm presently the president of the American Society for Peripheral Nerve. Very soon to hand over, of course, to Dave Brown, who will be an excellent president in the following 2018 year. As this present president, it really is my privilege to be one of very many wonderful presidents in a very exciting, growing, and important society. It is composed primarily of plastic surgeons, neurosurgeons, orthopedic surgeons, and I was going to say few neuroscientists, but a growing number of them. And it was my privilege as the president to be the first neuroscientist to be in this position. I really hope that in the years to come, more and more neuroscientists will join in to this society, because it is one that concentrates on peripheral nerve and peripheral nerve injury, which is a very important topic which is becoming neglected by the Society for Neuroscience, as an example, where neuroscientists have in the past and continue to attend yearly annual meetings. So as the current president, for a few more minutes, I'd like to say how much of a privilege it's been for me to be the president of this society, to contribute a small token to the society, and to continue on to a growing and very, very futuristic society in many ways, because it's blazing a trail in both improving peripheral nerve surgery and also in research into topics of which we know little at the moment, and we should progressively know a lot more. And of particular importance is that as surgeons, you can actually translate many of the findings in the laboratory to patients, to help them and to improve function after peripheral nerve injuries, pathologies, and so on. Thank you.
The opportunity to talk to you this morning. Being elected a president of the American Society for Peripheral Nerve was the greatest honor of my professional life. The presidential year was fantastic and wonderful for me, essentially because of the group of people I was working with. The council that worked with me was really wonderful, and people were really committed to do the best for the society. And my program chair was Dr. Greg Burchell, who's also the program chair for this meeting. And working with him was a pure joy. So the most important thing about the ASPN is, number one, the ASPN strives to be the best and the most relevant peripheral nerve society in the world. And let's think about it. In the past 25 years, most of the advances in the peripheral nerve research and surgery came from members of this organization. But in addition to the academic excellence, there is a family environment without the dysfunction of any family. People really care about you, people really support you, and there is mutual respect and mutual love between the members of the society, and everyone tries to help the other. So if you are not a member of this society, I would urge you to be a member of this society as soon as you can. You will never regret this decision. Thank you again for allowing me to talk to you this morning. Have a wonderful meeting, and I love you all. Thank you.
Hi, this is Wyndell Merritt. I'm one of the past presidents of the Peripheral Nerve Society. When we first met to discuss creating the society, I was not particularly in favor. I didn't feel like we needed another clinical organization until Susan Mackinnon and Lee Dellon and the people there explained to me that we wanted to create an organization that had basic science as a background to try to find clinical application, that basic science peripheral nerve papers would have difficulty often getting in the clinical programs of the Hand Society and the Hand Association. And this seemed a worthwhile effort with particular invitation to basic scientists and to other people that are interested in peripheral nerve, and not an exclusive organization and not particularly only clinically oriented, but in particular trying to appreciate neurophysiologic studies that would be applicable for clinical use. This seemed worthwhile in a niche that needed to be filled. Our first meeting was in Charlottesville, Virginia, and I was the host because I belonged to a country club in Charlottesville and we could get the space free. Our first president, Julia Terzis, was a bit late. I remember vividly she had a new Porsche and was stopped on the highway running about 95 miles an hour, and explained carefully to the patrolman that he was only holding her up more and she would have to drive faster if he didn't get out of the way. Only Julia Terzis could possibly have gotten away with that. When I was president in 1996, we moved for the first time away from the Plastic Surgery Society meeting and held our meeting in Williamsburg, Virginia, which had me rather alarmed because I didn't know if anyone would show up. My program chairman, Bill Kuzon, kept telling me not to worry, and he was absolutely right. We had a large attendance, and many of them international. I've been very pleased with the merger of our meeting with the Microsurgery Society and Hand Association, because I think for our international travelers, the long trip is more worthwhile when they have more than one organization. I think our future is secure because peripheral nerve problems remain a conundrum and unsolved. The future seems bright with measurements of functional MRI and the better understanding of the interface with neuropeptides and the neurovascular features, and the transplant medications. All of these, I think, mitigate for a bright future for our organization, and I am very proud that we have lasted.
So one of my earliest memories of the American Society of Peripheral Nerve is the planning committee. Well, that's a bit of a misnomer because I was the planning committee. In the early 90s, with only about 30 members, you had to multitask and do a lot of things yourself. My most vivid memory was trying to attract exhibitors. We would have the meetings in not real exciting locations, and we only had about 30 attendants. So when I would speak to the exhibitors and ask them to come to our meeting, they would ask how many attendees, and I would say 30, and that would end the phone call. Shortly after that, we began discussions about teaming up with some other society, and the ASRM and the AAHS were also thinking about a combination meeting. And as I joined the executive committee of the ASPN, the talks got very serious, and we had to take a vote, and I think it was one of the most influential decisions that the leadership of ASPN ever did, was to vote to become part of the TRI meeting that we now all share and enjoy. We were worried at that time that ASPN would sort of get shuffled to the shadows, but that really hasn't proven true. Our meeting has actually grown in size and attendance, and helped us become financially solvent. So it was a great decision by our leadership, and it's grown into a wonderful meeting, and I wish the current leadership continued success.
Hi, this is Greg Evans, ASPN President, a few years back, and I just want to wish everybody a very happy new year and continued success to the society as it continues to grow in members. Thank you.
This is Howard Clark, coming to you from the University of Toronto, where it's a balmy minus 13 degrees Celsius. I'm filming here because it reminds me a bit of the meeting we had in Boca Raton, Florida when I was the president, at which time it was also pretty chilly, even though we'd gone to Florida to escape the cold. I do have some simple advice for those of you either embarking as new investigators in the ASPN or midway through your career, and that's to simply remember the things you learned in undergraduate science. An experiment is set up with a null hypothesis. You design the experiment, collect the data, undertake the statistics you already planned, and then you live with those results. Live with the results, give us conclusions that are based on those results. So I hope you have a wonderful meeting. I'm only sorry I can't be there to share it with you, but have a great time. Take care.
First, I'd like to thank Allison Snyder Warwick for conceiving of doing this while the founding members are still alive and we can speak to you on video. I'd like to thank Andrew Yee for taking time to do the video himself. And as I think back for historical tidbits about the foundation and founding of our society, the American Society for Peripheral Nerve, I remember sometime around 1989, a group of us at the Plastic Surgery Research Council meeting together with Julia Terzitz. Julia Terzitz really had the idea to start this society. None of us thought we needed another society, certainly not another meeting. But Julia felt the peripheral nerves needed a society of its own, not just to have nerves presented at the hand surgery or the microsurgery meeting. And so we got together. The point I wanted to make was I didn't want to have a meeting where we just sat and heard many more papers. And so I'm proud to say that the format today includes my original suggestion, which is that we should have 2 or 3 basic scientists each speak for about an hour. Start with very baby steps of what they do in their lab and work their way up for those of us who are mostly clinicians so we could follow what they do and then try to take some of their ideas and translate them into our practice. And so we agreed to have this society. Julia was the first president. Julia, as you know, is Greek, but in more particular fashion, she's Macedonian. And she really pushed me to travel around the world to learn what goes on and to teach and to spread ideas. And the Peripheral Nerve Society is like that. We have members from many, many countries. Well, in a particular contribution that I feel I may have made, Julia was the first president and was president for 2 years. I was the second president, 1992 to 1993. We needed a tie. So blue-green is my favorite color. Turquoise, and walking tracks were a technique we used in our research, and I conceived of having a club tie made with walking tracks that would be on a blue-green background. Susan made a unique contribution to our society as one of the founding members. She's very artistic, and she created our logo, which would be a hand holding a Schwann cell. And so the tie has the logo at the bottom and the little walking tracks going up along it, and it was given to the presidents. I'd like to show you an example of that. This is Dr. Tommy Tung, who was our president just recently, and he came to Johns Hopkins. It was my honor for him to come. He gave the A. Lee Dellon lectureship in peripheral nerve surgery. It was the 3rd time that was given. And at that time, he wore the tie that we developed. And you can see Tommy wearing that. Next to him, I'm standing. On the other side of Tommy is Andy Lee, our chief of plastic surgery. And to my right is Gedge Rawson wearing the same tie. Gedge was my second peripheral nerve fellow and is treasurer of the American Society for Peripheral Nerve this year. After my presidency, 2 of Julia's mentors became president, Beres Strauss and Bruce Williams. Bruce Williams was from Canada. That's where Julia got her PhD. I'd like to point out, and I think it's true, that Julia is the first plastic surgeon to get a PhD. She got it from Dalhousie University in Canada, and I was honored to be one of the examiners for her PhD thesis. Well, following that, there were a series of Canadians after Susan who became president of our society. We've now had neurosurgeons, 4 of them become presidents of our society. And of the presidents of our society, Susan, one of them trained with Susan, 1 trained with me, and in the upcoming group, 2 have trained with Susan, 2 have trained with me, and Dr. Tung, bless him, trained with both of us. I want to just say one final thing about the world of peripheral nerve surgery today. Susan and I worked together. I had the honor of being part of her hand fellowship, 1981 to 1982. Following that, she and I wrote 40 research papers together. We won 7 plastic surgery national research prizes. We wrote 1 book, textbook, Surgery of the Peripheral Nerve. She won the Canadian Gold Medal Prize. I was not allowed to be named on that because I'm not Canadian. But the work that we developed first in the laboratory for nerve regeneration through tubes has developed into what's now a huge event in peripheral nerve surgery. After the work we did with tubes and it was approved by the FDA, many other companies came along with their own version of the tube, and now Axogen has an allograft because the work, and this was done actually in Susan's lab, nerves prefer growing through an allograft than growing through a tube. They like structure. And so that's one huge part of peripheral nerves today. The second part, which Susan's contributed when she and I diverged in our research efforts, is the nerve transfer work. I diverged into continuing my work on diabetes, recovering sensation and neuropathy. There are now 3 level 1 studies and 3 economic cost-benefit analyses about this. It's being done all over the world. And then just recently, we had the first ever joint denervation workshop at the Mayo Clinic. I'm writing a textbook on that now, and that will start another big area of peripheral nerve surgery. Well, thank you very much for listening to my historical tidbits.
Hi, welcome to the 2018 meeting of ASPN. It's really my pleasure to share with you my favorite memory of the meeting. The very first meeting I attended was in Vancouver, British Columbia in 1998. I gave a talk on motor unit remodeling following peripheral nerve injury and repair. I gave the talk, and I think the talk went pretty smoothly, but as soon as the talk was done, Julia Terzis got up and asked me 3 very difficult questions. I did my best to answer the questions, but I don't think I actually answered any of them. At that moment, though, I realized this group is a group of real scientists. This group is a group of real clinicians. This group is a group that advances the field through innovation and discovery. This is the premier group of peripheral nerve surgeons and scientists in the world. It was such a pleasure to become part of the group in 1998. And has been an increasing pleasure for me to continue to be involved with the group ever since. I haven't missed a meeting since 1998 and have no intention to do so in the future. Thanks for allowing me to become part of ASPN. Enjoy the meeting.
Hello, I'm so happy to be here today in Arizona. It gives me a chance to wear my vintage ASPN hat. As you can see, we got this hat in 1996. Susan Mackinnon was the president, and we had the ASPN meeting in St. Louis. We actually went to a baseball game, and it was a wonderful meeting. And it's really, really impressive to see the continuation and the growth of the ASPN. It's been an organization for young people who are very interested in research, and it continues to remain the same. So I'm really proud to wear this hat, and it just shows you don't throw anything away. Thank you.
Hello ASPN friends, it is my pleasure to share a few moments with you via this video. This is Ivan Ducek, 2011-12 ASPN President. I want to thank Alison Snyder and Greg Brochelle for this kind invitation. I've been attending NERV meetings since 1998 and have enjoyed very much growing into the society and learning many things from all of you. It is amazing to see how 15 plus years ago you had maybe 1 or 2 person in the audience when lectures were given usually at the very end of the day, while now we have full rooms, people interested in nerve injuries and nerve repair and how to solve difficult nerve problems. I think it is the joint task of all of us that managed to bring the Nerve Society to this level. I certainly want to thank all of the founding members of the Nerve Society to have a vision many years ago when they established the society. As you can see, making this video is much easier said than done because I had to cut all of those O's and wiggles with my shoulders and whatever else not. So Alison, although you said this is going to take 2 minutes, this is my 7th recording, so thank you very much. In any event, looking into sharing some opinion with you, I would like our society to take a little bit more proactive approach in addressing some of the criticism of the nerve surgery by different academies and societies. We do remember very well in the past how, for example, patients with diabetic neuropathy were considered as surgeries being done on these patients unnecessarily. Similar experimental attitude by insurance carriers and by some societies I expressed as well towards the headache surgeries. Some states struggle with, do we need to have a mandatory nerve test done before the surgery or not, in a way that nearly workman's comp dictates what tests we need to order before surgery or not. So I would like to suggest for all of the upcoming generations and all of us practicing to create a task force within the society that would have a role to objectively review the data and issue annual 1 or 2 or 3 treatment guidelines recommendations in terms of where the role of the nerve surgery stands for headache patients, for diabetic neuropathy patients, for patients with chronic nerve injuries. As you know, many insurance carriers sometimes suggest that patients should first get, after exhausting medical treatment, also interventional pain management treatments like radiofrequency ablation or neuromodulation prior to agreeing to approve the nerve surgery. Unfortunately, completely missing the fact that nerve surgery, fortunately or unfortunately, is the only tool out there that is capable of addressing the cause of the problem, rather than just symptomatically masking symptoms with drugs or some other expensive devices. In the past, our society took a fairly passive attitude towards this, and we allowed other academies and societies to take a fairly heavy swing on nerve surgery role. Unfortunately, this is now being quite generously abused with insurance carriers, stating, you see, there are different societies that are actually opposing nerve surgery for these conditions. I think there is plenty of evidence-based data out there that treatment guidelines task force could gather together and issue to properly vetted society channels appropriate public statement what Nerve Society position on certain procedures is for certain medical conditions. As the past president, I have been willing to supervise such a task force for some time. As you know, I cannot do groundwork there, but if we collect a couple of bright people to be on that panel, I think we can help thousands of people that are otherwise mistreated by some dogmatic opinions and some mainly symptomatic directed treatments that unfortunately have no chance of changing the cause of the problem. I would say that this would be pretty much my main message today. Again, looking forward to a great program that Alison and Greg set in Phoenix, And again, looking forward to spend some good time with everybody in next couple of days. Have a good day.
Hi, I'm Bill Kuzon, and I am happy to give this message as a past president of the American Society of Peripheral Nerve. I have actually been to every single peripheral nerve meeting. The first one I went to, I was a senior resident at the University of Toronto, and I drove there with one of my colleagues. The meeting was in Charlotte at the University of Virginia, so it was actually a really, really long drive. It's been very gratifying to see the organization grow, and especially now there's so many young and enthusiastic people involved that the organization is in good hands, and I think it has a great future.
It was a great privilege to be one of the ASPN Presidents. The meeting which I held was in Puerto Rico. We're supposed to actually repeat that this year. Unfortunately, for reasons well known, we were not able to go again to Puerto Rico. Over the many years, I had also fun and privilege to work with many colleagues who are established, as well as young people, residents, students, whose love of peripheral nerve surgery is always stimulating all of us and is actually making us eager to go so high as being the president of ASPN. I wish everybody all the best, and I'm looking forward for the development of the society with new generation.
Thanks. It's great to make this video for the ASPN series. I really got involved more than 25 years ago, thanks to Susan Mackinnon, who was my graduate trainee supervisor at that time at Toronto. In fact, the meeting was held in Toronto, and it was a very small venue and a one-day meeting from what I recall. The meeting has, of course, grown a lot, and 10 years later, in 2000 and 2002, I was really honored to be the scientific program chairman 2 years in a row, with David Chu first and then with Nancy Mckee. Those were exciting days indeed, as we'd combined the meeting from a single one-day meeting to a tri-meeting that is the current format. And it was great to be involved with the inception of that format and help navigate that so that we could develop a very successful program, which still stands to this day in terms of its overall format. A few years later, I was really honored to be the president of the ASPN in the meeting that we held in Puerto Rico. I still recall being there with my family with a large palatial room overlooking the warm Caribbean Sea. Those were great days indeed. The meeting has grown so much. It's got great diversity, great enthusiasm, and tremendous scientific programs. I really think it's the greatest meeting that we have, and I look forward to it each and every year. I know this year's meeting will be a tremendous one, with Tessa being our president, and Allison and Greg doing a great job as scientific program chairman. I look forward to it, as well I look forward to all future meetings. Thank you.
I think peripheral nerve is still among the least understood of the surgical subspecialties, especially in regards to regenerative capacity and surgical techniques. We see a lot of patients for whom the best option is still unclear, or there may seem to be no good options, and you may be their third or fourth opinion. I would encourage everyone, and especially the younger generations, to keep open-minded, to think out of the box, and to investigate, design, and try new things, especially for those patients who really have nothing to lose or will certainly not get better on their
Hi, this is Nancy McCabe bringing you greetings from Toronto and other places. I will not be attending the meeting, but if I had, you might have enjoyed talking to me about canoe trips. We did the Nahanni at one point. And somebody who is I've always respected is shown here, and Winston Churchill is responsible, I guess, to a certain extent for the way the world is now. And I wish you all the best from the North.
Allison, thank you for this opportunity to talk about a society that I really absolutely adore. In the 1980s, things were really happening in the field of nerve research and nerve surgery. And initially, Plastic Surgery Research Council provided the forum for discussion for plastic surgeons interested in this topic. But it became such an exciting time for us that we really ran out of space on that with that group. And it was the American Society for Peripheral Nerve that was established to allow us to talk to each other about things we were really so passionate about. In retrospect, we can now see that the 1980s was the decade of the paradigm shift from nerve repair to nerve graft. There were a lot of changes happening then, a lot of excitement. And in the 1980s, things we took for granted now were considered controversial. Neurolysis, the existence of topography within the nerve, the use of nerve conduits, and in many institutions, even nerve grafting. Sir Sidney Sunderland and Leonard Goldner were firmly on the side of nerve repair. Alan Hudson, Dave Klein, Raymond Curtis had already shifted to nerve grafts for longer nerve gap injuries. My surgical practice started just as this paradigm shift was occurring, and I considered all of these men on both sides of the paradigm shift as iconic giants. I'd like to reflect on a few specific cases to demonstrate how much has changed in nerve surgery over my career. As a resident in 1968 in Toronto, we repaired nerve injuries in the emergency room in our civilian clothes. I remember going up to the operating room and wheeling down this new piece of equipment, the operating microscope, to the ER to do a repair. At one of the first plastic surgery rounds that I attended at the University of Toronto, two particular cases were discussed. One was a 1.5 centimeter gap in a digital nerve that was repaired with a nerve graft. The consensus of the U of T surgeons was that the gap was too short for a nerve graft. The second case was the excision of a recurrent lipofibroma of the median nerve. This excision left a 9 centimeter nerve gap, and it was determined that that gap was too long for a nerve graft. And I remember shaking my head thinking, you've come back to do nerve grafts, this new exciting thing, nerve grafts, and they're going to have to somehow be between 9 centimeters and 1.5 centimeters to fit the requirements of the University of Toronto Division of Plastic Surgery. In the early 1980s, I would bring Sir Sidney Sunderland's very big textbook with very complicated drawings of the internal topography of the various nerves to the operating room to try to figure out whether there even was topography. These maps were really complicated, and so I thought one day that I would try a new idea, and that would be awake stimulation. So I talked to the patient, talked to the anesthesiologist, did a dissection of the ulnar nerve at the wrist, and then with everyone agreeing, including the patient, we lightened the patient up, woke the patient up, and then I used a little nerve stimulator to stimulate the medial side of the ulnar nerve, and nothing much happened. And then I stimulated the other side of the ulnar nerve, and the patient sat up and vomited. So there definitely was topography of the ulnar nerve at the wrist. This is something that our medical students now would not come to the operating room without knowing specifically the topography of the ulnar nerve at the wrist. We didn't even know if it existed. A quarter of a century ago, we thought nerve conduits and acellular substitutes for nerve grafts would be a big advance. Now those are delegated preponderantly to the small diameter, small gap, non-critical nerves. We didn't even predict nerve transfers in the early 1980s. We wouldn't have imagined the techniques that we use today to get inside a nerve and move nerves around, and the results that we can get with nerve transfers. Without the American Society for Peripheral Nerve and the culture it provides, I don't even know if nerve transfers would have existed, let alone translated so quickly. ASPN has some unique qualities. It's safe to speak your mind. You know your opinions will be heard. Its membership is inclusive by definition, and it encourages diversity. There's no bullying, no backroom deals, no blackballing. The professionalism of this group is its best quality. When ASPN was founded in the early 1990s, I don't think anyone would have predicted how much the management of nerve injuries would change in a quarter of a century. 2018 is exactly an exciting time again for nerve surgery. If we look forward another half century, another quarter of a century, without doubt, the advancement in the management of nerve injuries will have improved equally logarithmically. And I predict, this is my prediction, I predict that we will be offering patients with nerve injuries techniques we can't even imagine today. The American Society for Peripheral Nerve provides the forum to discuss issues relating to nerve injury. The nerve injured patients are helped with this specialty. The members of this specialty, I thank every day for all of the contributions that they've made to advancing the care for nerve injured patients. It's been such a privilege to be a member of this group.